Hi, everyone. Jeanette Almonte here, Director of Nursing for Oncology. We just thought we might do two high fives this week because the Daisy Award nomination list is so long. I think if I read it all in one, it'd probably be over 15 minutes. So we're going to split it this week, and you'll get two high fives this week. First, let's start out. We want to give a big, huge shout out to our apheresis team. Yesterday, the 19th, was APHERESIS Awareness Day, and they had a spectacular day. They actually were able to have a table outside of Malberg and inform people of what they do. And I want to stress that our apheresis nurses, although they are part of the Department of Oncology, they have their own unique specialty. And yes, they do service the majority of their patients are oncology, but not every single one of them. They have a large portion of benign heme patients and also nephrology patients. They have a few other special diseases under them that they service. So big shout out to them. Thank you for all of your hard work and dedication. And the truth is that our other programs, like our bone marrow transplant program, cannot be as successful if we didn't have such an amazing apheresis team. And this is just a true testament to Johns Hopkins, to our department, and to our nurses that we are better together, and we are able to achieve many things due to the people's hard work and their dedication to our patients. So thank you, apheresis team. We couldn't be as successful as we are without you. Big shout out to you guys. The second thing is our CEUs, and more CEUs. For our oncology team members, please remember, we have to have 12 CEUs per year, oncology specific, for all of our nursing team. And the reason of that is because we are COC accredited, Commission on Cancer. And one of those requirements is that our nurses can verify that they are basically cream of the crop. And we know we're cream of the crop. We just have to demonstrate that. And one way to do that is through our CEUs. Now, if you are OCN, if you have your OCN certification, you do not have to do the CEUs. But you can still, you can maintain your OCN, and there's criteria for that. Almost everyone's performance appraisal goal will include the CEU language. So expect that in all of your performance appraisals from now until forever, specifically for all of our oncology nurses that touch patients. So please keep that in mind as you are working through the year. There's many opportunities to obtain free CEU. We do a lot of lunches, lunch and learns, a lot of CEU offerings throughout the year, so please keep a lookout for that. The third thing is I want to let everyone know and welcome this new person that will be joining our leadership team. Her name is Adella Brooks, and she will be our new Assistant Director of Nursing for ambulatory. She will be joining us next week, and please look out for that announcement. We're going to have a gradual integration into the ambulatory area, and she will start off primarily with our infusion team, phlebotomy area, and OTC to start and become acclimated to our Johns Hopkins health system. So thank you very much for that, and please welcome her as soon as you see her throughout the hallways and once her announcement is out. Thank you. Flu vaccines. We are approaching the season of mandated flu vaccine. We're in it, actually. The deadline to obtain your flu vaccine will be November 17th. If you have some sort of religious exemption, that is due to the health system. So that means you have to upload it into the VMS system by October 31st, 2023. And in the email, look out, there's going to be a schedule of days that you can get your flu vaccine at the Fifth building. There's also a voucher that you can obtain through the VMS system if you want to go to like a local Walgreens or something like that. So please keep that in mind. And without further ado, the best part of the high five is those Daisy Award nominations. And I must say that the 5 5C and 5D team really, you guys totally outdid yourselves. I feel like the Daisy Fairy was just giving out nominations out there to everyone. Please fill out this form. This is awesome. You guys, I mean, really remarkable work. This Daisy Award was given to the following people: Haley Glover from 5C, Kate Gaspar. Kate, I feel like your name is here all the time. Big shout out to you. Kate Gaspar, Michaela Lewis, Amanda Palumbo, Morgan McHugh, you guys got double and triple. Okay, this is the same one. All right, and it reads, excellent care, very helpful, attentive, hardworking, kind, caring, efficient, prompt, great listeners. So big shout out to all of you guys. Thank you so much for your hard work and dedication. And then this next one was nominated for Morgan McHugh and also Grace Waterman. And it reads, during this past week, excellent care and service provided, very attentive, efficient, hardworking, caring, kind, helpful. So thank you guys. That is so awesome. And the next two actually is for Rick Malik. Thank you so much, Rick. And this reads, Rick is an outstanding nurse. He goes beyond his duties to help you. He is very thorough. My husband has tubes in his back, and Rick took his time to make something to help him from sticking in his back. When he comes in the first thing in the morning, he checks Tom from head to toe. I have never had a nurse as good as Rick. There have been a lot of good nurses at Hopkins. Nobody can be compared to Rick. So thank you so much, Rick Malik. That's beautiful. And this other one is also for Rick. I am 68 years old. I have never been in a hospital as a patient, nor have I never been sick before. 3 months ago, I was informed I had mantle cell lymphoma and was sent down to Johns Hopkins for chemo treatment. I was terrified arriving here. My nurse was Rick Malik. This man made my whole stay here for 3 days very pleasant. He was my angel. He took very good care of me, explained every procedure, and after I checked out, took me to outpatient service to get a device installed on my arm. He also took the time to introduce himself to my wife, who was here to pick me up, and explain to her what all I have done for my 3-day visit. He is great, and I hope he is considered for this award. Rick, thank you. Rick, this is amazing. Thank you so much, and it's a testament to your dedication. I also want to take the opportunity to give you a big shout out for being our wound TA. Really, your dedication to wound care and continuing the program for our inpatient service has been truly noted and remarkable. Thank you so much, Rick Malik. And going back through the list, this next one is for Amanda Palumbo. Amanda went above and beyond with my son, Mr. Randall, while he was a patient. She was very attentive to his needs. She was always checking on him and his family. She is very friendly and outgoing. We never had to ask for anything. To find out that you have leukemia, it's nice to have a nurse that is going to take very good care of you and your needs. Thank you, Amanda. Awesome. And this one is for Michaela Lewis. During 2 days of difficulty as tube feeding was introduced for my wife, Miss Diaz, Michaela performed with extraordinary skill and efficiency, reading the situation intuitively as Debbie experienced abdominal pain and the feeding rate had to be adjusted. Michaela's overarching expertise was supplemented by small but important gestures of help. As Debbie went from bed to chair, for example, Michaela smoothly threaded the cable for the call button and the tube for the suction around the bed and onto Debbie's lap. It might sound minor, but it was typical of Michaela's situational awareness, her thorough kindness, and her ability to quickly take tasks to their full completion. Among the many fine nurses we've encountered here, she stands out and deserves recognition. Thank you so much, Michaela. And I believe we've covered them for this sitting. More to come towards the end of the week. Big shout out to everyone. Remember, I know that some people get called out on the Daisy Award, but it takes a village for everyone to be able to help one patient. So big shout out to you guys. Thank you so much for all of your help, your support, your dedication, your hard work. Thank you. Have an amazing middle of the week. Bye, everybody.